Medicine, religion, and spirituality share a long history, as evidenced by the roles of healers such as priests and shamans. This is only natural because history tells us that ancient civilizations believed diseases were sent by gods or devils. For centuries, medicine was a profession attending to both body and spirit, with patients often viewing physicians as secular priests who help them grapple with the spiritual aspects of their illness. Historically, many hospitals were founded by religious organizations and espoused values of compassionate service. As medical science and technology evolved, contemporary physicians no longer saw it as their role to care for patients' spirits. And the advances in medicine in the beginning of the 20th century resulted in eliminating the humanistic and spiritual aspects of patient care. From that point on, physicians and health practitioners have been educated to look at the physical body as the sole cause of illness, completely neglecting the whole of the spirit or the spiritual dimension of whole patient care. By the late 20th century, there was a greater outcry from the public for more holistic and spiritual approaches to medical care. While more medical professionals are beginning to recognize that spirituality is a core patient need and has beneficial influences on health, some in the medical community think it conflicts with medical science.
The research indicates that people who are more religious, those who are more involved in their religious communities, are healthier, have better mental health, have better physical health, and tend to live longer as well.
According to the 2013 International Consensus Conference on Improving the Spiritual Dimension of Whole Person Care, spirituality is defined as a search for meaning, purpose, and transcendence, and a connection to the significant or sacred. And it can be expressed through beliefs, values, traditions, and practices. So, by this definition, spirituality is an inseparable aspect of humanity. The content and the basis of spirituality in medical courses have changed from 1992 to the present. Initially, courses responded to patient need as demonstrated in surveys. Then, it began to emphasize the clinical aspect of spirituality, and more recently, began to integrate the spirituality of the clinician as a way to help students identify with their role as healers. Given that, 1, spirituality is associated with reduced mortality and risk for certain diseases, 2, there's a growing number of patients with chronic conditions and suffering, and 3, physician burnout is increasing. Thus, spirituality is both relevant and timely. Requiring spirituality as an integral component of medical education would bring medicine closer to the World Health Organization's long-standing definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We cannot serve our patients well if we only focus on the physical aspects of their illness, and neither can we rely on other members of our team to take care of the psychosocial and spiritual issues as ancillary luxuries. the core element of the healing relationship is our ability to adequately address all the concerns of our patients and their families, psychosocial, spiritual, existential, and physical, and to work in partnership with experts in each of these domains. Anything less than this is both inadequate and unethical in meeting our professional obligation to our patients and their families. And the goal of the Spiritist Medical Association is to promote the integration of spirituality in the practice of medicine, as we believe that spiritual well-being plays a key role in prevention of diseases and in the healing of those who have become ill. Let us gear up to discuss these vital topics as we welcome you to the 7th U.S. Spiritist Medical Congress, Integrating Spirituality in Clinical Practice.
Good afternoon, everyone. I am Leticia Klausner.
And I'm Dan Assisi.
In the name of the United States Spiritist Medical Association and all sponsoring organizations, we would like to welcome each and every one of you to the 7th U.S. Spiritist Medical Congress. As many of you know, this is our biannual event. This year, we would like to express our gratitude to the Spiritist Federation of Florida and all the volunteers who helped organize and plan this event.
We want to remind you of some important aspects to make sure that the day goes smooth. First of all, we ask that you please turn off your cell phones. And if you put them on vibrate, make sure you lower the volume too. We also want to remind you that bathrooms are staged right outside in case you need to go out during the talks. More importantly, books are staged left over here. What you're going to find today, of course, is just a smidgen of all the topics, but if you want to dive deeper, please find the books there. And very importantly as well, we want to make sure that you know that there will be a panel, a table session at the closing today, and if you'd like to ask questions, please write them down in a little piece of paper and pen that you were provided in your registration bag, and in case you don't have one of those, please look for one of the volunteers, but write them down, and don't forget, please, to write who the question is addressed to as well. We really appreciate that. And of course, no food or drinks allowed inside the auditorium.
Also in your welcome bag, you will find a survey for this event. Please take the time to fill it out and drop it off with one of the volunteers or at the registration desk. Your input is very important to us. Now, we are pleased to invite Dr. Sonia Doi, who will give her welcome address in the name of the United States Spiritist Medical Association. Dr. Doi is currently serving as president of the U.S. Spiritist Medical Association, the International Spiritist Medical Association, and the Allan Kardec Spiritist Society of Maryland. Professionally, she's a medical doctor, PhD, adjunct associate professor of medicine at the Uniformed Services University, and member of the board of directors of the National University of Natural Medicine. Please welcome Dr. Dai.
Thank you. Distinguished speakers, ladies and gentlemen in the audience, my dear volunteers and friends, good afternoon. On behalf of the Spiritist Medical Association, I welcome all of you to this event with my heart full of joy and gratitude. I want to begin by thanking this amazing body of speakers that we have here today that have so kindly accepted our invitation in donating their time out of their busy schedule, time that they could be with their family and friends, and yet they're here spending the weekend with us. So thank you from the bottom of our hearts. I want to recognize and thank the amazing team of volunteers working under the leadership of Andrea Marshall Neto. Everyone here that you see working from the registration desk, the book sale, the technical team, the translator, everyone is giving their time as a volunteer, and I'm very grateful to all of you. Thank you. I also want to express my gratitude to the sponsors and donors whose generosity have contributed to defray the costs of the event and made this possible. Thank you so very much. And because this is a meeting on spirituality, it is just appropriate that we recognize and thank the spiritual guidance and support that we have received in organizing this event. So, thank you. The SMA, the Spiritist Medical Association, has completed 12 years since its foundation and 10 years as an incorporated 501c3 nonprofit organization. The cause we work for is to promote the integration of medicine and spirituality. We know that integrative medicine has already become a discipline in most medical schools, and that spiritual assessment has been included in clinical assessments. However, it seems that in general, we don't go further than assessing whether or not a patient is affiliated with any religion or faith, and whether the patient has spiritual support. But we can and should do more. Evidence from scientific research has shown that our emotions and mental status play a key role in our physical health. There's also a body of research showing that religious and spiritual practices can improve health status and response to treatment overall. Now, I want to make sure and make clear that we are not advocating for spiritual practices as an alternative to conventional medicine. We advocate for an integration of approaches to care for the whole body, spirit, body, and mind. Because we are spiritual beings. And I like to refer to the quote by Pierre Teilhard de Chardin that I bet most of you know, that we are not human beings living a spiritual experience. We are spiritual beings living a human experience. So we can go beyond assessments of spirituality by being attentive to the true source of diseases, assessing the inner suffering of the soul, being compassionate. This is what promotes healing. There's also a quote that I found once in a textbook of integrative medicine by Dr. Reiko that says, "Cure and fix when able. But if we ignore healing, the cure will likely not last or will give way to another disease that may not have a cure." And as you have seen in the little video that we showed, it makes a mention of a recent article by Dr. Christina Puhalski, who is the director of the George Washington Institute for Spirituality and Health. This paper was published about 2 months ago. It's beautiful, and it's entitled "Training Physicians as Healers." And we completely second her on this idea. That's what we are aiming for, a future medicine. Our speakers today and tomorrow will share their invaluable knowledge, their research data, clinical and personal experience that supports an integrative approach in healthcare where doctors embrace a healing interaction with their patient. It is something that is happening already, but we aim to have this integration happening more and more, growing to have a shift in a conventional paradigm. But shifts go slowly. And the Spiritist Medical Association works to promote that shift. So I wish you all enjoy the meeting, and please help us to carry on this cause. Thank you so much.
Thank you, Dr. Doi. That was great. If you need or would like to know more about the United States Spiritist Medical Association, you can always find Sonia Doi during the break, so don't be shy.
At this time, I would like to invite Marcelo Neto, President of the Spiritist Federation of Florida, for our initial prayer. Please.
Good afternoon. Loving Father, Supreme Intelligence of the universe, first cause of all things, we are here in the name of your love, trying to find ways to make the connection that long ago seems to be interrupted. Yes, we are souls in this process of evolution, transcending our physical experience to one day reach the plenitude and find ourselves in connection with your divine love. Here we gather together, many physicians, professionals, doctors, nurses, people like me and many others, trying to see this bridge that will establish one day the constitution of the true being, a conscious one. Help us to understand that everything is in the right place, going to the right direction. And in this note, we ask your blessings so you can illuminate the minds and the hearts of each and every one here, so this small gathering could be a piece of art, a piece of love, a piece of harmony. Bless each and every one here, people that came from afar, from many places in this beautiful country that we call United States of America. And one day we will be only one flock under the guidance of your supreme and infinite love. Thank you so much, and so be it. Thank you.
Marcelo. That was great.